Assalamu alaikum and welcome to Medicower on IQRA TV. I'm your host for today, Rabina Mir. Today's topic is about something that's quite serious and something that's happening quite a lot around us. Again, we're talking about strokes today. So hopefully the conversation that I have with Dr. Liz this evening will be of use to you in helping you to not only recognise the signs, but what to do if you are unfortunate enough to be around somebody whilst they're having a stroke. So welcome again, Liz.
Good afternoon.
And I guess the first question should be, what is a stroke?
Right, well, everybody's heard of a heart attack, and everybody knows a heart attack is very serious and we've got to act immediately.
Yes.
And I want people to think of a stroke as being a brain attack.
Okay.
In other words, it's very serious and we need to do something about it quickly.
Okay.
So strokes are very important because probably about a third of people will die of having a stroke.
Wow.
There's about 150,000 deaths per year from strokes. I bet everybody out there knows somebody who at some stage has had a stroke.
Yeah, I think you're right.
Now, some people can make a very good recovery after a stroke. Some people are left with a disability.
Okay.
But I just want to really emphasise how important it is to understand about strokes and to know what to do.
Okay, so what symptoms might you have if you are having a stroke?
Well, what happens if you have a stroke or a brain attack is that the blood supply very suddenly to a part of your brain is blocked.
Yeah.
The blood is not getting to the part of your brain which it needs to get to.
So that's because we're losing oxygen to the brain.
Exactly.
Okay.
Now, our brain controls how our body works. So, I can lift my arms, my legs, I can walk, I can talk. All these things are because my brain is in control. So, if something happens to my brain, then that control is lost.
Right.
So, for instance, if the part of my brain which controls my arm has the problem, then I won't be able to use my arm. If a different part of my brain is affected, it might be the part of my brain which controls my speech.
Okay.
So my speech will be affected.
So this depends on which side of the brain this
Well, it
damage
depends,
happens.
first of all, which part of the brain. So it could be the arm part of the brain, or the leg part of the brain, or the speech part of the brain.
Sure.
But what's quite interesting is this side of my brain, the left side of my brain, controls my right side.
Okay.
So actually, if you have a stroke which affects your right side, the problem actually started in the left part of your brain.
And vice versa.
And vice versa.
So what actually causes a stroke then?
Right, well, do you remember I said that the problem is the brain is not getting a good supply of blood. And that can be due to two reasons. One of them, and the most likely reason, probably in about 85% of the time, is that the blood tube carrying the blood into the brain is blocked. So we have a blockage and the brain is not getting through to that part of the brain.
So similar to how a heart attack could be to do with a blockage of cholesterol.
Exactly.
This is another blockage
exactly
of the
the
brain.
same thing, but happening in the arteries in our brain.
Okay.
So a part of our brain is not getting enough blood, and unless the blood manages to get through that blockage, that part of the brain is incredibly sensitive and it will die within a very short time. So that's one reason people have a stroke, a blockage causing a stroke. The other reason, not as common, but in about 15% of the time, is that there is a bleed. We have a hemorrhage or a bleed inside our brain. So instead of the blood being directed at the part of the brain and it flowing there smoothly,
Right.
a hemorrhage.
So very sudden.
Very sudden. Both things happen suddenly.
Okay.
So we can get up in the morning and feel absolutely fine, and by an hour later, people can have had a stroke.
So I guess one of the things we need to talk about is what are the signals that a stroke is coming, or would we not have signals?
No. Most people will know something is happening. So, for instance, they may find that they can't use their arm.
Okay.
So I'm here and I want a drink, so my arm reaches forward and I have a drink. However, if the part of my brain that controls my arm is affected, I can't move my arm. I might want to move my arm,
Sure.
but my arm will not move.
So that's
I might want to stand up,
Yeah.
but my leg is too weak and it won't let me stand up.
Okay.
So I may notice a weakness. The other thing, I mentioned that a stroke can affect your speech. So you and I are having a conversation and then I can't get the words out.
Okay.
So, or I may find that I lose some of the vision in my eye. I may be walking along and I start to lose my balance.
Are these things likely to happen all at the same time? Or I know you said it's to do with which bit of the brain that's going to be affected, but could you just have one of those symptoms?
Yes, definitely. So it may well be a stroke that will only just affect your arm. So the only effect you may have may be that you can't lift your arm up. And you can lift this one up, that's fine. But the damage is in one side of your brain and it's that arm that won't work. So I can't, Rabina, I wish I could give you an exact way of knowing if you're having a stroke. But because everybody is different, everybody will have a different symptom.
So who can get a stroke then?
Lots of people get strokes. Well, as I mentioned, it's a very, very common thing. So let's start with, for instance, high blood pressure. High blood pressure is a major risk to have a stroke.
We've talked about that before as well.
High blood pressure can cause strokes. Diabetes can cause strokes.
Okay.
People who perhaps have already had angina or problems with their circulation in their legs, where they've already got some narrowing of other arteries, it may affect that part. It may be an artery in their brain next time, so they could have a stroke.
Okay.
People who don't do very much exercise are more at risk of having a stroke.
This now fits with why so many people have them with all these sort of categories. It's a lot of people that could be in those categories already.
I've made a list because I don't want to miss anybody out.
Sure.
And I'm going to really hammer this home. People who smoke are twice as likely of having a stroke of somebody who doesn't smoke.
That's,
So if you think of the people you might know who've got diabetes, high blood pressure and smoke and maybe don't do very much exercise, just think what a high risk those people are at.
Yeah.
People whose level of cholesterol are high,
Right.
they may be more likely to have a stroke. Once you've had one stroke, you are more at risk of having another stroke. So just because you've had one, don't think, oh well, it's not going to happen again.
Yeah.
Most people who've had a stroke, or a lot of people, may go on to a further one.
Okay. And
Chaps-
is there a time frame for that, or is
No.
it variable?
Variable, completely
Okay.
variable. More men than women,
Really?
yes.
Any particular reason for that?
Often to do with the smoking, the blood pressure, that sort
Not
of
taking
thing.
enough care of themselves.
Yeah, very often. I was going to mention as well, ethnicity plays a role.
Okay.
So black Afro-Caribbean people are more likely to have strokes, probably twice as likely as white people. The reason being, they are more prone to high blood pressure.
Yeah.
So you can see a difference within ethnicities.
And high blood pressure is one of those things we don't necessarily pick up on unless we already have been monitored for
exactly.
it. So it's one of those silent things, isn't it?
So certainly everybody over 40, it's very wise to go to the doctors every now and again and have that checked. Well, you don't need to see the doctor, you can go and see the nurse.
And the pharmacist nowadays, is it?
Absolutely. So I think I've mentioned most people there who are likely to have
I
strokes.
don't think there's many people not on that list.
Well, I hardly dare say it's very rare, but some children can have strokes.
Yes, I have heard
Pregnant
of this.
ladies
Right.
it's a time of your life for a lady when you are slightly more at risk. Certain drugs can cause strokes.
Okay.
So drugs high in estrogen, again, very rare. Please don't be frightened of taking contraceptive pills and things, but the estrogen does mean you are at an increased risk. People who take cocaine, drug takers,
Right.
Not many people know this, but that puts you at an increased risk of a stroke. So you can see we've got a lot of people who are potentially at risk of having a stroke.
My next question was very much around, and you've given some reasons there for what you can do to prevent risk, like the smoking, like not taking recreational drugs and not doing, not sort of looking after your blood pressure and things like that. But what else can you do to prevent a stroke?
Well, I think lifestyle is very important. So I think I'm going to end up repeating what you've said, really. You know, if your blood pressure's high, you need to be on tablets. If your cholesterol's high, you should be thinking of diet, but also very likely taking tablets. Having some sort of physical activity. I mentioned about lack of exercise.
Yeah.
Now, physical activity means you could be gardening. You could walk to the shop instead of getting the car. You don't absolutely have to join a gym.
No.
All those sorts of things can be helpful.
So it's about movement, isn't it, and doing it at a pace so that you can build it up, I imagine.
I think lifestyle has a big part to play, but we've also got the slightly more medical side of it with the blood pressure, etc.
Okay. Can you tell if somebody might be having a stroke?
Well, do you remember we said how perhaps they might find they can't lift their arm up?
Yeah.
They might start to slur their words.
Okay.
It might affect their level of consciousness, so they might not be quite as alert. So I think it's a matter not just of people understanding what's happening if they're having a stroke. It's also very important for you and I as family members, friends, to understand so that if we're ever with anybody who we fear could be having a stroke, we know what to do.
I guess it's easy to also dismiss some of these symptoms if they're happening in isolation, couldn't you? To think, oh, my arm's a bit heavy or it's not right, and then maybe you feel better a little bit later on and you dismiss it and don't talk to anybody about it.
Well, if you thought somebody was having a heart attack, Rabina, what's the first thing you'd do?
You ring the ambulance.
You'd ring 999. You'd say, I think my friend, my dad's having a heart attack, and the ambulance people would say, right, we're sending an emergency ambulance. So what we should be doing is if we think somebody's having a stroke, we should be ringing 999 and we should be calling for an ambulance.
Yeah.
In fact,
And if
Rabina,
you're not sure, ask really.
we need to work fast. So I would like to show you
Okay.
something we have been advertising so that people understand what to do. So could we have our poster, please, for fast?
Oh, there we
Thank
go.
you. Now, I'd like you to look at this, Rabina, because this really does tell us what we need to do. So, FAST, F-A-S-T. So, let's start with the first F. The first F stands for face. Now, if you look at my poster here, you can see a lady's face. And what you may notice is that the muscles in the face lose their tone and the face droops. So somebody may, for the very first sign, say, oh, my face, and notice that one side is now different from the other and it's drooping. That might mean they may be just losing a bit of saliva because they can't close their mouth properly. It may be they can't smile because one side of their face isn't working.
Yeah.
It may affect how they talk because their facial muscles don't work properly. So, F for face. A for arms. So it might be, I'm going to scratch my head, I'm going to scratch it with my other arm. Oh, I can't lift my arm. I want to take a cup of tea, but my arm doesn't work. You may say to somebody, lift your arm up, what's funny? And they'll say, I can't lift my arm.
Yeah.
So it's a weakness in the arm. The picture of the poster shows somebody who's dropped a cup because they suddenly lost the strength in their arm. And do you remember we said it is a sudden thing when people start to have a stroke? The last one is, the next to last is speech, because part of your brain controls the part of, controls us talking. And that can be that you can't get the words out, you just can't think what the words are you want to say, so that would show itself by somebody,
Sure.
the words won't come, or it may be the wrong words come out. So, Rabina, I want a banana, when you don't want a banana, you want to go to the toilet, or the wrong words come up, all wrong. So speech can be affected at the start of a stroke.
So these are very common symptoms we're talking about.
And the T at the bottom, T for time. Time is so important. Time to ring for an ambulance. Time to ring 999 and say, I think my friend is having a stroke. So F for face, A for arm, S for speech, T for time.
That's why it's fast.
You won't forget that, will you?
No, I don't think I will.
Fast, very important.
So why do we need to get to hospital quickly then?
I'm glad you asked me that, because I think I need to explain that. Do you remember we said there are two different sorts of strokes? One is a bleeding reason,
Yes.
and one is a blockage.
Yeah.
And what we know now is that we have drugs which, if they are used quickly enough, can actually remove that blockage.
Right.
But you need to be in hospital to have the drugs given, and you need to work quickly, because we only have a very short time, probably, well, under 3 hours. 3 hours is the perfect time. So in the olden days, where we might have said, oh, my arm's funny, I can't lift it up, or the speech is funny, never mind, I'll see what it's like tomorrow. Too late. We need to work quickly. So this is why fast, face, arm, speech, time, so important. Get to hospital. At hospital, they need to find out if your stroke is a bleeding stroke or a blockage stroke.
So how do they do that?
They would do that by arranging a scan.
Right.
So a scan can tell them very clearly if you have a bleed in your brain or if you have a blockage. But again, that scan needs to happen quickly, because we need to base our next treatment, if possible, on knowing what the scan shows. Because if you were the person that had the bleeding stroke, there is not any treatment available promptly that can stop or reverse. I did say reverse. Make a big difference to the long-term outlook of having a stroke.
So you said you can have a reverse of a stroke. How can you recover from one?
Well, if you have a blockage which is stopping the blood getting through to the brain doesn't die absolutely immediately. It has a time where it's really badly damaged, but if you can get the blood to that part of the brain by removing the blockage, there is a chance, and a good chance, if it's soon enough, that that part of the brain will recover, and therefore the controlling part of the body that was lost will come back.
So what if you didn't get to hospital quick enough to reverse it?
I'm afraid that would just be so sad, because potentially we could make such a difference if we get somebody to hospital quick enough to start this special blockage treatment. But
so they wouldn't necessarily die, but their quality of life would be different.
Yes. Yeah.
Okay.
Yeah.
So
we're talking quite serious, aren't we, Rabina?
Yeah,
really?
absolutely. And I think this reinforces how important it is for us to take seriously our health and all the things you talk about in lifestyle. We hear about it all the time, but it's so easy to just think, I'll do it tomorrow, or I'll...
And the trouble is, we think, oh, well, that happens to other people. What we've got to realise is that common strokes are one of the commonest reasons that people die. And therefore, it is likely to happen to within somebody within our family, our community, our friends, our workplace. So, yeah.
So what else is done to help treat a person with a stroke? I mean, if somebody doesn't recover quickly, or they're not going to recover as well as we would like.
Well, let's sort of walk through with a patient going to hospital. So let's hope the patient has been, is in a position to ring an ambulance, or the family or friends are there to ring an ambulance. They've got to hospital. They've possibly gone through having the special treatment. In going into hospital, the doctors, the nurses will have to assess this is a stroke. Now, obviously, there are, when I say obviously, there are other conditions which can mimic strokes. So, for instance, if somebody has diabetes and their blood sugar goes very low, they can lose consciousness, they can slur their speech, they can be completely in a mess. They don't know if they're coming or going, they could fall over.
Is that what we call the diabetic coma?
No, that's called a hypo, a low sugar.
Okay, low sugar.
So we need to be sure, you know, is this person really having a stroke? Have they just had an epileptic fit?
Right, okay.
Because after an epileptic fit, people can have different problems. So certain virus illnesses can be so bad they could affect your balance. There are reasons why some people can lose part of their sight. So they have to be assessed to be sure this could be a stroke.
Okay.
So there's a lot going on at the beginning. Their blood pressure. If your blood pressure was very low, that could make you fall over and faint. That could be mistaken. Blood pressure, very important, because if you've had a stroke, it may be really quite high. So a lot of assessment going on at the beginning.
Even more reason to why we need to get to hospital fast.
Absolutely.
To have these things checked.
So our patient now has gone to casualty, he's been assessed, they do think it might be a stroke, they've done the scan, they do think it might be a blockage, so that person has hopefully gone on to have the treatment, because not everybody is suitable for the treatment, so again, that has to be assessed carefully.
Okay.
So we'll move on to that stage, or we'll also say it may be a patient who wasn't suitable for the treatment or who was having a bleeding stroke.
Yeah.
So at this stage, once we know for certain the patient's having a stroke, then we would want to get them onto a special stroke ward, because we know that the people who work on the special stroke wards have all the talents and all the skills to help the person in the best possible way to make the best recovery from that stroke.
Okay. So when somebody's had a stroke, some of the things I was looking at on my list here were to do with swallowing, feeding, speech, dressing, toileting,
Can I
walking.
just interrupt you, because I think what you've said about swallowing is so important. I mentioned how a stroke excuse me, can affect your speech, but also a stroke can affect swallowing. Now obviously, if you can't swallow properly and somebody starts to give you a cup of tea, that can be really dangerous because you could choke on it. So anybody going into hospital, or if we find somebody we think they've had a stroke, our natural, oh, let's make a cup of tea, we'll get you feeling better. Well, actually, no, that's not a good idea until the person has been assessed properly to see if they can swallow.
Okay.
And for some people after a stroke, they can't swallow. They may even need to have a tube so that they don't become dehydrated, but that needs to be assessed properly.
And is there care that can be given to somebody that's in that situation to get their swallowing back on track?
Well, yes, you've probably heard of speech therapists who are the people who can often help with those problems. But the staff working on a stroke ward, we call it a multidisciplinary team. In other words, it's made up of people with lots of different skills. So we might have a physio, so somebody who could perhaps help somebody to walk again.
Okay.
We might have an occupational therapist, so somebody who could help you to try to learn how to dress again if one of your arms isn't working as well, or how to make a cup of tea if you can only use one hand. Speech therapists to help with the speaking. So we've got lots of people, not to mention the nursing care. You know, perhaps our patient does have diabetes. We want to make sure the diabetes is well controlled. So we need doctors to check on that.
We're going to have to come back and finish some of this, Liz,
there's
because
more to talk about.
There is a lot. I can see that, and I think it would be useful to talk about some of those in a bit more detail in terms of what to expect, as well as why we need to keep going with looking after ourselves. Okay, we're coming up to the break time now, inshallah. We'll see you after the break to continue the conversation about strokes. Assalamu alaikum.